Hi guys! Hi ka-curlies! Good afternoon! So this is your Doc Kulot, and today we have a very special guest because today we will learn more of our oral health. So marami sa atin ang napapabayaan ng isa sa mga pinaka-importanteng part ng katawan natin, which is our teeth. Syempre, when we smile, yun talaga yung nakikita ng mga taong bayan, kumbaga. So this afternoon, we are very privileged to have an orthodontist with us this afternoon, and a tooth fairy here in Zamboanga City. So we will be talking about different things about oral care. So kumbaga, titingnan natin paano aalagaan ang ating mga ngipin at paano natin ma-maintain ang magandang smile. So this afternoon, we are very privileged to have Dr. Lala Tammang with us. So Dr. Lala, hello!
Hi everyone! Hi!
Hello sa ating 2 million viewers. Sa mga nanonood, please reshare po ng ating video.
Pero share our live.
Yes. Actually, Doc, whatever our interview we'll have here, nare-repost ko to sa aking YouTube kasi nasa save siya. So, yon. So, Doc Lala, thank you talaga at napaunlakan mo ang aking
Thank you
interview.
actually for having me here in your live Facebook.
Alright. So, Doc Lala, gusto ko lang malaman, syempre you're a dentist, no? Let's start with, ilang ngipin ba tayo meron? Kasi baka iba-iba yung numero ng ngipin ng iba't ibang tao dyan. So, technically, ilang ngipin meron ng isang patient?
There are 32 permanent teeth and 20 baby teeth na tinatawag po nating deciduous.
Oh, wow. So, 30, bilang-bilangin nyo na natin dyan, ha? Kung kompleto pa yung mga ngipin.
But sometimes, we have a condition called mga anomalies po na kulang po yung lateral incisors.
Alright.
So, it's good if you have visit your dentist regularly if it's not 32 or 20.
Alright. Okay. So, 32 po for adult and 20 naman na tinatawag yung deciduous teeth for children. Ngayon, now that we've talked about teeth, kailan po yung first expected na lumalabas or nag-e-erupt na teeth for babies po?
For babies. 6 months, as early as 6 months, you will notice that there is a bulging in your baby's teeth.
As early as 6 months. So, definitely, medyo, siya, no? Mahirap siya if the baby is breastfeeding. Baka mag-bite sila.
That's why there is what we call a ngingipin.
Alright.
So, the children sometimes experience pain. Sometimes umiiyak po sila. They won't be able to express to you na they are in pain or tinatawag natin teething or nagngingipin. Alright. So, sometimes din po, nagtatae din po sila. So, you have to make sure na it is not for fever. Sometimes they have fever also. So, if you have your medical doctor, like
me,
if she checks it na hindi naman po regular yung kanyang fever, you can also, they will actually refer you to the dentist.
Alright, sa mga sa mga nanonood, lalo yung mga mommies, yung mga first time moms, no?
Do not panic.
Oo, do not panic kasi sometimes we are expecting at 6 months of age, nagbabulge na yung mga teeth ng baby. So, dapat either pumunta tayo ng medical doctor or pumunta pa tayo sa dentist to check on kung ano yung nagbabulge doon sa gums ng baby natin. Alright. So, Doc, you were mentioning earlier, no, na hindi naman talaga na-express nila yung pain. So, likewise, hindi naman talaga sila marunong sa oral care. So, ano yung mga pwede ninyong maituro sa ating viewers on how to take care of the oral care or oral care or how to do the oral care lalo na sa mga babies and toddlers po?
So for toddlers, let's start with the infants. You can use clean towel.
Alright.
And then as the child magiging 1-year-old na siya, you can use also this jelly rubber toothbrush. You can buy it po in the department store or sometimes Shopee.
Salamat, Shopee!
Salamat, Shopee! Sana bigyan nyo kami ng
So, merong mga...
Yes, they have this rubber jelly type of toothbrush. You can use on a 1-year-old child, and then you can also use a good toothbrush if the child is 3 to 6 years old. And syempre,
adult na.
Yes.
Alright, so for babies, no, pwede pala yung towel. Or
clean
pwede yung jelly na
Yes.
parang...
Do not.
Ano yung nilalagay lang ba yun siya dito,
Yes.
Doc? Tapos nililinis.
Yes.
So how often naman siya ginagawa for the babies, Doc?
3 times a day, sana.
Okay.
Then do not use the milk for sleeping. I mean,
okay.
do not, in short, wag siyang ibabad
Okay.
for yung mga milk pag natutulog.
Kasi nakaka-apekto.
Yes, it's sugar.
Okay.
It's sugar. It is also the reason bakit makikita nyo na yung teeth niya ay magiging weak, puti, and then sometimes it will cause cavities or yung black thing na nakikita nyo sa mga bata. Since magiging weak siya, madali siyang masisira.
Alright.
Do not use your milk pampatulog.
So definitely, pag nagsisleep na si baby, pwede
They can use the clean towel with a little bit of water para
Okay.
ma-erase lang siya or
para
ma-clean.
malinis lang natin,
Yes.
no? Alright. Sige, Doc. Now naman, on adult, paano yung correct steps on taking care of the teeth of the adult? Kasi alam ko may mga flossing,
Yes.
brushing. So can you tell us more about this?
Before I go there, of course, they will ask kung kailan nagsa-start ang permanent teeth.
Yes.
So, for permanent teeth, sometimes nagsa-start siya 6 years old, but sometimes for boys, it is delayed.
Alright.
Do not panic. For
Gusto ko yung,
children,
do
girls,
not panic.
for girls, sometimes 6 years old to 7 years old.
Okay.
So how do you take care of them? For the permanent teeth, regular visit to your dentist is wise because
okay.
prevention is better than cure.
Correct.
For 6 years old,
Opo.
the first permanent molar and first permanent incisors is already erupted.
Alright.
So if you do oral prophylaxis at age of 6 is better. Plus, fluoride is good for the children also. Children's teeth. Kasi
alright.
since healthy pa siya,
Okay.
the fluoride will become the moisturizer of your baby's teeth.
Itong fluoride na tinutukoy mo, Doc, ito na yung toothpaste.
Yes, it's not like, actually, it's a gel type po siya. It's not the toothpaste
okay.
po. But toothpaste has fluoride.
Fluoride. Kasi sorry, hindi
Yes.
alam ko kayo din na-share ko.
So, the toothpaste has fluoride.
Alright.
And in the dental setup, they have this concentrated fluoride for the teeth to be soaked.
Talaga?
Yes.
Oh, actually, na-learn ko yon. So, may mga fluoride-based na
Yes,
gel.
concentrated
gel.
Yes.
Na pwedeng nating ibigay to the kids para mas maging healthy yung teeth nila.
For
home care.
Home care, yes.
Alright.
You have. But for the dental clinics, it is more concentrated.
Okay.
So-
So, kumbaga, it is really nice at an early age na dadala na natin yung mga babies at mga anak natin
Yes.
to the dentist para maalagaan ng
Yes.
mabuti.
As early as 2, you can invite your kids to visit our dental clinics
Alright.
while you have your prophylaxis done so that they
Okay.
are already introduced to the sounds. Like, for
Oo,
example,
kasi nga, Doc,
drillings.
medyo scary kasi for other kids,
Yes.
yun, no?
Yes.
So, how do you handle yung mga ganon? When
They
you
will
have-
observe, actually. The
Okay.
kids actually observes the parent to have their teeth clean.
Okay.
And then sometimes I have a time because I'm by appointment system. So they
very,
have- yes.
very busy po si Doc Lala. Actually, nabigyan na rin ng opportunity. Napaka-busy ni
Yes.
Doc Lala.
So sometimes I talk to the kids. I will ask them to sit down to the other chair
Okay.
and introduce to them. And if I have time, I will also explain to them what's this, what's that. And
Okay.
then what is important here, we are building rapport.
Okay.
So that when the time comes, it's time for them to clean their teeth, they are not scared anymore.
Okay, so dapat talagang may rapport na
Yes.
nabibuild, Doc, no? Kasi nga yung mga bata, very, scared sila dun sa
Yes.
sound.
Yes.
Tapos, kapag ako kasi personally, if I go to my dentist, may mga sound nga talaga. Minsan naisip ko, paano kaya kapag mga bata na yung inaalagaan nila? So, yun
Aminin
pala
nyo,
yun.
tinatakot nyo yung mga anak nyo. Pupunta tayo sa dentist, di ba? So, do not do that anymore.
Oo, so dapat pala hindi ganong pananakot.
Yes.
Similar din yan, doktora, dun sa aming mga doktor. Pupunta tayo sa pedia natin, ganon. So, huwag sanang ganon kasi nagkakaroon
Yes.
sila ng trauma.
Yes, and what's good with our social media now, the kids are very, very aware about their oral care, so
Alright.
they are not scared anymore.
Okay. Eto, Doc, may gusto lang akong tanong. Actually, it's a personal question. Kasi may mga patients akong nami-meet na sinasabi nila, they have bad breath, no? Tapos, nahihiya silang makipag-kiss sa partner nila. So, ano ang mga tips, practical tips mo sa mga patient na may mga bad breath?
Actually, there are two kinds. Kung if you have halitosis or bad breath, you can ask your medical doctor to check kasi sometimes depende po sa smell.
Yes po.
If you are diabetic, if you
Apo.
have problem internal, so you have to also ask for the medical advice. But
Alright.
for us, you can also do home care. You can check first your oral care because if you have cavities, it can cause bad breath.
Apo.
If you have bulok na teeth, it's also causing
Bad
bad breath.
breath, yes.
And sometimes naman, you can add a little bit of spice. Like for example,
Ay,
you
gusto
gargle.
natin. A little of spice gusto
Kissing
natin.
Kissing eh.
Kissing, oo,
A little bit
tama.
of spice. Like for example, you can gargle with different kind of mouthwashes. And sometimes
Okay.
you can drink a lot of lemon before.
Oo.
And then, regular visits is also important. Oral prophylaxis twice a year. Then, if you are smoking, every 3 months is okay.
Okay, para makita natin
Yes.
kung may nagbibuild ng mga
Yes.
nicotine. Yeah.
When we already eliminate those, if there's still smell, you can visit the medical doctor.
Oo. So, in other words, pwede kapag you are experiencing bad breath, pwede nating tingnan siya at the level of the teeth or of your
Yes.
gums. Kung negative, sasabihin na ni Dr. Lala na, ay, it's all clear now, then baka naman, the problem is really coming from the oropharyngeal area. So,
Yes.
ganun siya. Pwede nating step by step. Pero gusto ko yung to put some spice sa
Yes.
mga nakaka-experience po ng mga bad breath dyan.
Yes.
At during kissing, napaka-importante natin i-highlight yung
We have
doktora.
spray. We have
Yes.
spray. We have this, a little bit of candies. In
Okay.
Listerine. May ano, plugging. So
May
they have
plugging.
this, yes. So they have this mint thing that you put in your mouth. It will give you a little bit of good fresh.
Ay, gusto ko yan. O, sa mga nakikinig dyan, alam niyo na paano ang mga ganap. Ha? I'd like to say hello to ito si April Gay to. Lagi ito nagwa-watch namin. Hi, April Gay.
Thank you for watching.
Thank you for watching. Pa-share po. Ma'am Queenie, hello.
Queenie, hello
Pa-share
po.
po. Ayan. So, Doktora, kasi ganito, I understand there was a time, or I think it's still happening, na may mga naglalagay ng DIY na braces. I'm actually having a brace also, and maraming nagdi-DIY. I'm sure hindi talaga yung nire-recommend natin. So, can you tell the audience ano yung mga indications kung kailan nagpapa-braces po?
Okay. First of all, DIY is illegal.
Yes po.
Okay? It is not for fashion. Putting braces is a condition. There are indications.
Oo.
And you need it not because
Para magpaganda.
yes,
Hindi siya ganon.
for bling bling.
Oo.
The
For bling-bling. Oh, hindi siya
Yes.
ganon.
The indications if you have crooked teeth,
Okay.
if you have spaces in between your teeth, you cannot floss. It is also indication.
Okay.
If you have a open bite, if you cannot close your mouth because you have an open bite, like that.
Oo, may mga ganon.
Yes, if you have an
oo.
open bite, if your lower is more forwarded than your upper, it is also indication, just like this.
Underbite ata ba yun? Overbite, underbite.
Yes, if you have also underbite and
Apo.
overbite, it is also indication. If you have clenching or you have pain somewhere here, it is also indication.
Okay.
But for you to be able to know, you have to visit the
Your dentist. Oo,
So,
tama.
you have to be very wise. If the doctor, you said that there is no such thing as home service.
Okay.
So, if they go to your house without gloves, you don't know na galing na pala sila sa ibang
Sa ibang
house.
patient.
So, wag na masyadong magtipid. Because if you want to do DIY,
Opo.
and it's just like for 2,000 pesos, and no follow-up checkup,
Correct.
there will be a chance that your teeth might worsen.
Opo.
Even if it's nice na to see,
Oo.
pwede siyang matanggal.
Correct.
And the worst, there will be gingivitis, periodontitis. Ang pinaka-worst, matatanggal siya. So, sayang lang din, nagtipid.
Oo. So, reminder ito sa lahat ng nanonood, when it comes to your teeth, huwag yun nang tipirin, kumbaga.
Yes.
kung wala pa namang budget, edi pag-ipunan po natin. Pero ang pinaka-message natin dito ay huwag mag-engage sa mga DIY na mga braces. Dapat po talagang pumunta sa doktor ninyo, yung sa dentist ninyo, para malaman kung may indication ba kayo. Kasi yung iba, alam mo doktora, ang dami ko kasing nakita, there was really one write-up to this, na gusto lang nila magpalagay kasi daw parang fashion. Where in fact, ang braces po ay isang procedure na ginagawa ng ating mga dentist.
Legit dentist?
Legit dentist para po alagaan ang formation ng ngipin natin. So at least we've learned ano yung mga indication natin.
May chika pa ako.
Alright, go ahead, doktora.
Okay. So, pag pumupunta po kayo sa dentist, ang oral prophylaxis is 1,000 pesos. So, pag kumain ba kayo sa labas, dala mo ang buong angkan, magkano ang ginagastos nyo? In a year, So, what if kaya mag-spend ka lang ng 1,000 pesos for your oral care and self-care? It's not bad anymore. It's not about budget. And you don't go to the dentist if you're in pain.
Correct.
Libre lang ang check-up ko.
Gusto ko yan. Libreng check. Tara na. Opo. Actually, ang ganda nung sinabi ni Doktor, oral care is equivalent to self-care. Ito talaga yung messaging ko lagi, doktora, na dapat may self-care po talaga. May it comes to the physical self-care, may it comes to the mental health care, and also to your oral care. Self-care yun. So, ibig sabihin, pang-aalaga po yun ng sarili. Kasi, how can you love yourself fully kung hindi mo makikare yung holistic approach ng katawan mo? So, kasama po doon ang oral care. So, sa mga naghahanap ng dentist dyan, we have Dr. Lala Tammang. Doc, you were mentioning earlier about visits, pero let's just recap. Kailan yung first visit at gaano ka-frequent ang visit when it comes to oral care po?
As early as 2, you can visit as early as 2 years old,
Alright.
the children can visit the dentist. And for the adult, anytime. You can visit twice a year. It
Alright.
doesn't have to be July, June. As long as you have time, try to visit. And then, do some oral prophylaxis. Then, if you have a dental home with your dentist, you can advance booking after 6 months so that they can call you. That is dental care, dental home care.
Okay. So, uulitin lang natin, ang oral care po ay nagsisimula as early as 2 years of age. This is, apart from care, yung bata, tinitake care natin yung teeth, nai-introduce natin yung bata sa setup ng isang dental clinic. And then for adult, they can do twice a year and can do oral prophylaxis. Alright, that's really nice, Doktora. Ngayon, Doc, siguro before we really wrap up this, can you tell our viewers practical tips on how to take care of their teeth po?
So, everything starts from you. You have to brush 3 times a day, wherever and
Whenever.
wherever you are.
Alright.
No? That's why I always give my ortho babies their simple kit. So wherever they are, they have to brush their teeth. Especially if you are eating sweets, you have to brush. Then drink a lot of water, eat healthy foods, you do flossing, you also use mouthwashes to make it more like fresh. And then at home, you can use also warm water with a little bit of salt. You can also use baking soda, mix it with water and sometimes with toothpaste so that you can have a shiny white teeth. And last but not the least, you have to visit your dentist regularly.
Alright. So, maraming salamat sa mga practical tips, Doc Lala. Sige, Doc Lala, can you please tell them saan kayo located and how can they communicate with you?
Okay. We have a Facebook page, Polish Dental Clinic. We are located at ground floor of Azinet Royal Hotel. It is called Polish Dental Clinic. You can reach us at 0917-511-9616. Iiwanan ko lang po kayo. You have to visit your dentist anytime because masarap pong kumain pag may ngipin.
Ay, gusto ko yan. Masarap. Kasi lisod kumain ng walang ngipin.
Yes.
Mahirap mag-chew. Ayan, Doc Lala, thank you po. Thank you for being
inviting
with,
me.
yes po. Thank you for being with us this afternoon.
Thank you for watching, guys.
Yes, this Facebook Live will be uploaded to my YouTube tomorrow. I hope you can rewatch this and reshare this because this is so important, no? At the end of the day kasi, Dr. I always believe na information is power. So, today we've informed you about oral care. I hope you can find time to visit your dentist and take good care of your teeth. Kasi iba talaga ang dala ng magandang ngipin. Maganda at healthy na ngipin. Alright, so with that, I thank you all for being with us. Thank you sa information, Doc Lala.
Thank you, Miss Katie.
Hi, Ma'am Katie. Hello
yes,
po.
po.
Si Ma'am Queenie was saying earlier, very informative daw po, Doc Lala.
Thank you so much.
po.
Remember guys, prevention is better than cure.
Correct. So with that, we thank you everyone and God bless you all. Thank you for having Doc Lala here with us. And on Saturday, I'll have the Ma'am Queenie of Queen's Fab Fash. She will tell us about how to start online selling effectively. So I hope you can share our page to people out there who would like to know on how to or paano. Kasi ito po yung reason ng page namin.
Congratulations.
Thank you po, Doc. So with that, thank you again and God bless everyone. Ingat ho kayong lahat.